welcome to today's call. I'm very excited to share information with you today about how you can prevent COVID death, prevent all-cause mortality from things like cardiovascular disease, cancer, depression, infections of various kinds. And I just want to say up front, I'm indebted to Dr. Alex Vasquez for this information. He's a mentor of mine. If you've read my best-selling book, he wrote the foreword of the book, and he's had a big influence on my career and, just the way that I practice. So thank you to him for everything, and particularly most recently, the studies related to this information I'm going to share today. And if you haven't checked out his information, inflammationmastery.com is where you can find him. He is the man, so check him out. But vitamin D, huge nutrient that we need to be sufficient in if we want to beat COVID. And this isn't news if you're in the functional medicine space or the alternative health space, but it is news if you watch mainstream media, because since the beginning of the COVID pandemic, they've vehemently denied that nutrition can be of any benefit against COVID. And our only hope has been to lock ourselves in our house and wear masks until the magic bullet vaccine is ready. And that's kind of an insult to humanity, because I think most humans understand that there's no way that there's nothing we can do until a vaccine's ready. There's got to be nutritional and lifestyle things we can do, because we've all been exposed to viruses our entire lives, many of which we haven't been vaccinated against, and we're not dead. So the science reinforces our thoughts. There's piles of science supporting vitamin D, vitamin A, zinc, and various other nutrients that I've covered in previous videos for antiviral defenses and anti-infection defenses. But I'm excited to share vitamin D information today because a new study just came out that we'll end with that is really a hard hitter. But first, we want to talk about vitamin D in relation to what's called acute respiratory distress syndrome, or ARDS. Now, if you've been watching the news since the quote-unquote pandemic started, you might remember ARDS, or Ards for short. And the reason that's significant is because early in the pandemic, ARDS was what everyone feared. If you contracted SARS-CoV-2, which is the virus that causes COVID-19, and you had a severe case, you may have a cytokine storm, which we've covered in previous videos. The cytokine storm is the massive inflammatory response that our immune system mounts against COVID or against a respiratory infection. It's so massive that it's too massive, it's abnormal, and that leads to lung damage, potential need for a respirator, and death. And so ARDS has been known for a long time, has been around for a long time, far earlier than COVID came on the scene. And you may notice this study here, you can see down in the left corner there, this study was published in 2015. So the title is Vitamin D Deficiency Contributes Directly to the Acute Respiratory Distress Syndrome, or ARDS. So remember, this study was published 5 years before COVID hit the scene, COVID-19, okay? Since COVID is a coronavirus, we've been exposed to coronaviruses for eons. Coronavirus causes the common cold, and it's said that up to 15 to 30% of common colds are caused by coronaviruses. So coronavirus isn't novel to 2020 to the human population, just the COVID-19 form is, but we've been exposed to its family members for years. Acute respiratory distress syndrome has been around for years, and it's been known for years that if you're deficient in vitamin D, that directly contributes to ARDS risk and negative outcomes. And so if you look at this study, you can see where I highlighted in the findings, they found that a vitamin D deficiency was ubiquitous in patients with ARDS and present in the vast majority of patients at risk of developing ARDS. So if you're deficient in vitamin D, you are at high risk of severe COVID outcomes, of potential cytokine storm, ARDS, and death. So we've had this information since 2015 minimum, And so why wasn't the first reflexive response by our governments, by our CDC, WHO, all the talking heads, why wasn't it, hey, we know this, scientifically it's validated, vitamin D deficiency promotes ARDS, and that's what everyone's scared of. That's why we don't want to be on respirators, etc. Well, we could have easily and inexpensively, you can see right here in the gray box, represent evidence that easily treatable vitamin deficiency may increase the risk of ARDS. Easily treatable, I mean, there's nothing easier than going out in the sun, but we'll talk about how that's not enough. So the next easiest thing is to take vitamin D drops. Okay, there's nothing easier than that. There's nothing less expensive than that. But if you've been paying attention, the goal isn't health. The goal isn't inexpensive treatment. The goal is to make billions on a novel, untested, unsafe vaccine. But for those who want to actually help people, vitamin D is where we want to start. And this study is the first of many to show that. What happens if you're vitamin D deficient? Why does that directly contribute to ARDS? Well, you can see right here, vitamin D deficiency resulted in exaggerated alveolar inflammation, so that's lung inflammation. Epithelial damage, that's the lung barrier, right? You've all heard of leaky gut. Well, you could also have leaky lung or leaky brain or leaky gums, okay? Or leaky bladder. Wherever you have an epithelial barrier, if there's damage to that, you could be leaky. So in the case of vitamin D deficiency and lung inflammation, you're promoting leaky lung. You're also promoting hypoxia. Hypoxia is a fancy word for low oxygen. Well, if we have lung inflammation and leaky lung, it makes sense that we would have low oxygen, or we wouldn't be exchanging gases, oxygen and CO2 properly, which may lead to hypoxia, further inflammation, and need for a respirator. Now, relevant to our talk last week, when I believe it was Janine asked the question about genetics and disease, and we talked about genetics and epigenetics. And we said that genetics load the gun, environment pulls the trigger, and the environment is the epigenetic influence on our genes. Well, check this out. The second line there. Vitamin D has trophic effects on primary human alveolar epithelial cells, affecting over 600 genes. Okay, so if we're talking about epigenetic influences, that sentence right there says vitamin D impacts human lung epithelial cells. It impacts over 600 genes. So if you want to positively impact your lung health, specifically, you want to have optimal vitamin D levels, which will promote optimal lung barrier function and decrease risk of lung inflammation, lung damage, ARDS, etc. So these authors conclude that vitamin D deficiency is common in people who develop ARDS. And one other little snippet is vitamin D deficiency increases risk of bacterial and viral infection. Well, why? How? This next study, you can see in the top left-hand corner, was published in 2018. Okay, so another one, the title, Effective Vitamin D Deficiency in Korean Patients with Acute Respiratory Distress Syndrome, ARDS. Remember, ARDS is what everyone feared relative to COVID, severe cases, respirator, COVID deaths. So the authors start off with the background. Vitamin D modulates innate and adaptive immune responses and is associated with increased mortality in hospitalized patients with pneumonia. Okay, so that sentence says, vitamin D supports innate and immune responses. So vitamin D is key in our immune system in both forms. Okay, the innate immune system, we could say, is the local police, the first responders. The adaptive immune system, we could say, is the SWAT team or the Navy SEALs. They take a little bit longer to show up, but they're highly specialized, trained killers. Okay, vitamin D promotes and modulates both forms of the immune system. So if we're deficient in vitamin D, our immune system isn't going to function properly on a global level. The next sentence, it said, vitamin D deficiency is associated with increased mortality in hospitalized patients with pneumonia. Okay, so again, when the pandemic hit, people were scared of dying again from lung issues. Well, pneumonia, flu, COVID are all upper respiratory infections, all drive a similar response in severe cases of cytokine storm, ARDS, death. So we already knew D deficiency promotes pneumonia. We already knew vitamin D promotes optimal immune response and antiviral response. Why weren't we promoting vitamin D as a first line measure right from the start? So this study the study looked at 108 patients and associated their vitamin D levels with ARDS risk. And it's interesting, the average age of the patients was 60 years old. We'll round up. It was 59.4. We'll round up to 60, okay? Vitamin D deficiency was found in 103 of the 108 patients, okay? So 108 patients with ARDS, 103 or 95% of them had low vitamin D or vitamin D deficiency, which was defined as a level of 8.3 plus or minus 7. So they had from 8 to 15 for their vitamin D number on their blood work. So all of you can go back and look at your blood work tonight and see what was my vitamin D level. This study is showing that these people were deficient with an 8 to a 15. You'll see when you look at your lab work, the quote unquote normal range is 30 to 100. So even the person with 15 was deficient by a lot, okay? Vitamin D levels were inversely related to length of hospital stay and intensive care unit stay. So the lower your vitamin D, the longer you were going to be in the hospital with ARDS and the longer you'd be in the ICU. So worse vitamin D, worse case. So vitamin D deficiency was prevalent in Korean patients with ARDS. Now, drum roll, here's the big one. This was published end of October, or published finally end of November. So a little over just under 2 weeks ago, November 27th, this was published. Vitamin D insufficiency may account for almost 9 out of 10 COVID-19 deaths. Pregnant pause right there, because that's a big statement. Vitamin D insufficiency may account for almost 90% of COVID deaths. Wow. Evidence from observational studies is accumulating, suggesting that the majority of deaths due to SARS-CoV-2 infections are statistically attributable to vitamin D insufficiency and could potentially be prevented by vitamin D supplementation. Vitamin D supplementation, whose safety has been proven in an extensive body of research, should be promoted and initiated to limit the toll of the pandemic. Associations between vitamin D deficiency, defined by a vitamin D on your blood work of 12 or less, or insufficiency, defined by a score of 20 or less. But those vitamin D insufficiency or deficiency labels were associated with COVID deaths, okay? These results, mortality was much higher among vitamin D insufficient patients than among other patients. So they looked at 118 patients at a hospital in Germany, and they found that 64% were vitamin D insufficient, while 41 patients were vitamin D deficient in that 64%, and 16 patients died of the infection. Mortality was much higher among the vitamin D insufficient patients than other patients. These results imply, red in the middle of the page here, these results imply that 87% or 9 out of 10 COVID deaths may be statistically attributed to vitamin D insufficiency and could potentially be avoided by eliminating vitamin D insufficiency. Jump down to the red at the bottom. It therefore appears highly debatable and potentially even unethical to await results of such trials before public health action is taken. What that statement says is, why are we waiting to roll out nationwide or worldwide care in the form of an untested toxic needle when we know that vitamin D could potentially prevent 90% of the Armageddon that they've been talking about since February? Unethical, right? Vitamin D is inexpensive, it's cheap, it's unethical. And what got Dr. Vasquez going on this topic this past week was that the UK, the United Kingdom, they put out a paper saying that they were going to provide the population of the UK, about 2.5 million geriatrics, I believe it was age 70 and up, they were going to provide them with 4 months worth of vitamin D supplementation for free. And they were, celebrating that like they were doing so much good for the people. But when you dive into the paper, you saw that they're providing them 400 international units per day, which isn't even enough for a baby. So it's about 10% of what a person needs at baseline. And so, yay, good for the UK, but it's not doing enough, and it's, too late for a lot of those people. So this is just information from a PubMed search you can do. You could search vitamin D and ARDS. You can search vitamin D and COVID-19, and this is unbiased. This is the scientifically validated information to show that just this one vitamin could prevent 90% of COVID deaths, and we no longer are talking about the pandemic. We're not locked down. We're not wearing masks. We're not saying, when can we get back to normal? Oh, you can leave your house when everyone's vaccinated. Unnecessary if everyone were sufficient in vitamin D. So let's open it up to questions.
So if we've got good vitamin D levels, we shouldn't worry.
Yeah.
If you have good vitamin D levels, you should be less worried. Absolutely. Vitamin A matters, zinc matters, the rest of your lifestyle matters as well. But, excuse me, this study right here would imply, yeah, if you were sufficient in vitamin D, at least 90% of us shouldn't worry.
I'm not worried anyway.
Yeah, neither am I. But this
So
is.
is there? Oh,
Go ahead.
so go ahead. Okay, I just had a question about the type of vitamin D. I know that in our supplements we get a particular brand or degree of vitamin D. Does that vary with the person, or is it a generic D3 versus a vitamin D, or however that is worded?
Yeah, good question. There's vitamin D3 is cholecalciferol. If you look on the back of your supplement, it'll say vitamin D3 and then in parentheses cholecalciferol. That's the form you want. Commonly, conventional medicine, when they prescribe vitamin D, it'll be vitamin D2, which is ergocalciferol, and that's garbage. And so that's why you may have experienced, oh, they gave me 50,000 IUs a week for X number of weeks and my vitamin D never improved. Well, one reason could be because they gave you D2, which isn't D3, which isn't what we think of as vitamin D. It would need to be converted to D3. And there's actually some data out there that says D2 increases all-cause mortality risk. So actually taking that may be setting the person back more than helping them. So yes, you want it to be vitamin D3 cholecalciferol.
So is that definitely a liquid form versus a supplement, a pill, or
no? You could get it. You could get it in drop. You could get it in capsule. Yeah, it can come in multiple forms.
Okay, thank you.
Yeah,
So,
just the dropping allows you to titrate dose more specifically, right? Whereas the capsule, it's like, here's a 5,000 capsule or here's a 1,000 capsule. So you got to swallow a lot of capsules, or you got to break capsules in half, or the drops allow you to dose more easily.
So, and then I was reading what you posted this today on the COVID could actually be detrimental to older people. I'm thinking about my mom, and she lives in a retirement. She's independent living, but she's living in a retirement community, and we're not sure if they're going to require her to get the shot or the to live there. So
yeah,
she's healthy. She's pretty healthy, other than her arthritis, but other than that's a little scary. So
it's highly likely that they're going to require it. because they're going to be pressured to do it, you know.
Mhm.
And the likelihood, the way that the ball is rolling is that everyone's going to be required unless we push back. And so a couple of weeks ago, Denmark required it, mandated it, and the people protested so much that they dropped the mandate.
Nope.
So people are going to have to push back, or else,
Mhm.
they're going to do what they're going to do. So I saw an article on CNN this week that, let me pull it up here, where basically the article was talking about the vaccine rollout, and they're already trying to CYA in terms of the damage it'll do to the elderly. And I'll read it to you here. It says, but there is also reason for concern. The COVID-19 vaccines have not been tested in the frail elderly, many of whom are residents of long-term care facilities. Since they haven't been studied in people in those populations, we don't know how well the vaccine will work for them. We know that most vaccines don't work nearly as well in a frail elderly person as they would in someone who is fit and vigorous, even if they happen to be the same age. So let's start with the elderly. Makes sense. Quote, we would not at all be surprised to see, coincidentally, vaccination happening and then having someone pass away a short time after they receive a vaccine. Not because it has anything to do with the vaccination, but just because that's the place where people at the end of their lives reside, Moore said. So in this article, if you want to look it up, it was published December 4th on CNN Health, and the title is CNN.com, excuse me. And when it loads, I'll tell you the title. But you can see, it's already been an issue from many people saying, before right now, the fastest a vaccine was ever brought to market, I believe, was 4 years, but it might be 7 years. And right now they're doing it in about 6 months, okay? Or that's the goal. And so look at the history of vaccination and the damage it's done on a global scale with 4 to 7 years of efficacy and safety testing, right? We're doing it for 6 months for Operation Warp Speed, and Thursday there's an advisory council meeting to ask the FDA for emergency use authorization for the Pfizer vaccine. So nothing. There's no way that this is going to end well in my mind, without ravaging people far worse than the virus does. I mean, the virus is 99.9% survivable. So why do we need a vaccine?
Mm-hmm.
It's 100% risk.
Well, the other thing that concerns me is that there are 4 companies trying to develop the vaccine or are developing the vaccine. So what makes one better or worse than the other? And, I mean, this should be red flags just because there's so many companies involved with this. So
it's not
you
about
go to the doctor, huh?
It's not about which one's better than the other. It's about who got there first.
Yeah.
Right.
But that should be concern to people just even contemplating the use of it. It's like, well, my doctor says I only need this one and not that one. And, so.
Yeah, it's like I said, it's not a line you want to be running to be first in.
Mm-hmm.
I'm sorry that for whatever reason, the internet isn't pulling this up. Maybe they took it down. But I'll read you the link for those watching later. It's cnn.com/2020/health/coronavirus-vaccine-acp-nursing-homes-question/index.html. So if you search that, you can find that article that I just read the quotes from. So yeah, the elderly, where was it? One of those studies I had highlighted. Let me stop this share here and show you this, because what I want you to understand is that vitamin D deficiency is not rare, is not uncommon. It's not something that is a surprise, okay? So here it is. Look, so here's the first study I showed you, published in 2015. We'd known it, okay? More than 1 billion people worldwide are believed to have vitamin D deficiency. Okay, 1 billion people, that's 1/7 of the planet, okay? So if we wanted to help in a virus situation where ARDS is the risk, like, hey, we probably need to roll out vitamin D in a massive way, okay? So again, obviously it's not about necessarily promoting health as the first goal here. What other questions? Come on, someone's got to ask it.
Scott has a question.
Go ahead.
I don't know if it's that question.
No, I did not read your mind.
Okay, well, I'll ask it if no one does. Go ahead.
Well, I've been playing Internet Doctor. And
Dr. Google, chapter 10 of my book.
Yeah.
Thank you.
Yeah.
See you soon.
Yeah.
I determined that you cannot get vitamin D from a tanning bed.
Oh,
From a what?
From a tanning bed, as opposed to the sun.
Yeah.
What is wrong with people?
Yeah.
So is that a question or a comment?
It was just a statement.
Okay.
That's
Well,
my
it's
professional opinion.
it's a good segue. Thank you, Dr. Scott. And as a corollary to that, someone usually asks, well, can't I just go outside and get vitamin D, right? And I've made videos on this in the past as well. So if you haven't seen it, shame on you. But basically, unless you live at the equator and you're naked 24/7, you're not going to get enough. Okay. And now that we're in winter and we're tilted away from the sun, the angle of incidence or the way that the sun's rays hit the earth, we're getting even less than we would if it were summertime. And the farther north you are, the less you get. So from a multiple sclerosis standpoint, it seems to be associated with the higher you are in latitude, the higher the incidence of multiple sclerosis, because the lower the vitamin D. So that's a big risk factor in MS specifically, but goes to show, unless you're at the equator, we're not going to get it with just the sun. So do you want sun exposure? Absolutely. But we're going to need supplementation. Okay. Why? Can I just get it from diet? No. The only significant dietary source is cod liver oil. And unless you really love that stuff, you're probably not going to get enough. So vitamin D supplementation is a necessity. And then if you have darker skin, it's even more of a necessity. So yeah, tanning beds aren't going to do it either. What else?
So is it vitamin D on top of a multivitamin, or do you get enough? I guess you'd have to read the label on your multivitamin.
I've read the
Right.
label on yours. Yeah. And the answer is depends on the
Should I
person.
supplement more? Yeah.
The answer is it depends on the person. So there's research back to 2003. And if you guys are interested in vitamin D, Dr. Vasquez wrote basically, quote unquote, the book on vitamin D in 2006. So he has a paper I can link to or send out to you guys. But essentially what he shows is that the average person, the average adult needs about 4,000 IU a day. And that's to be baseline. Remember, physiology is dynamic. So we don't get to optimal D and stay there, because we're always dealing with inflammation and exposure to viruses and all of these things. So it's a fluid level. So 4,000 IU a day is kind of that break even. And then depending on the physiology, Karen, what's going on, you may need 10,000 a day for a time or less, right? So it depends who we're talking to, depends what your initial level was, what else is going on in your physiology. But it's unequivocal that 400 IU a day is not enough. And that's the RDA, or the recommended daily allowance. Okay, that's not enough for an infant. So for an adult, that's laughable. And that's part of the problem with, say, the mainstream supplements that you can go get at Harris Teeter or Walmart or whatever. Is A, they may have the poor form. B, they're not going to have enough. D, they're probably filled with binders and fillers and garbage that, you know, are going to impact you a different way. And it's not probably, actually, a study was done, police departments and I believe the FBI combined, I think it was 2013, to go to like Target and Walmart and GNC and buy vitamins and just study, is what they say is on the label inside here. And what they found was, the answer was no. It's like, what they found was like chopped up plants and dirt and just filler. So who knows what you're swallowing in those things. So the most expensive vitamin is one that doesn't work. Okay. So you might get at Costco the 8 million count fish oil, but if it's all, you know, rancid and oxidized, you know, your $4.99 was wasted instead of spending, say, the $40 on a month's supply that's actual fish oil that's going to help you. Same for vitamin D or a multivitamin or whatever we're talking about.
So you said the need for vitamin D is like a flow depending on what you're going through. What are some of the things that you would need more vitamin D? Are we talking like winter time as being one of the?
Yeah. So, you know, wintertime would be one. Any inflammatory process would be one, because remember, D is needed. D is used by your innate and adaptive immune system. Okay, so one thing it does is it sensitizes your immune cells. You have immune cells called T regulatory cells. So those are cells that modulate the immune system, or the conductor in the symphony, right? So they have an anti-inflammatory effect, or basically what they'll do is they'll prevent the cytokine storm that drives ARDS. So if you're lacking D, you may be too inflamed, right, and lead here. So they can have a quieting or an immune modulating effect, so an anti-inflammatory, like shh, chill. But they can activate that innate and adaptive response against a viral pathogen or a bacterial pathogen. So they can turn it on, and that would promote inflammation. But the key there is it's the adequate amount of inflammation against the target, right, versus an over-exuberant inflammatory response that you see when vitamin D is not there. Does that make sense?
Yeah.
Or say you're not infected. Say you're just, say you have high blood sugar. High blood sugar drives inflammation. Again, that's a pro-inflammatory response. We need to put that fire out. Vitamin D is one of our best fire extinguishers. Vitamin D helps keep your barriers tight, not leaky. So if you have leaky gut, right, that might be because you're insufficient in vitamin D, or a vitamin D insufficiency will exacerbate that. Vitamin D is needed in your mucosal, your mucosal membranes to promote what's called antimicrobial peptides, which are things that keep microbes from entering. So that's a function. The bone health and the muscle health, you know, that's like old news, but you know, if you have muscle pain, that could be due to vitamin D deficiency. If you have bone issues, that could be due to vitamin D deficiency, because vitamin D, calcium, phosphorus, parathyroid hormone all function to keep your bones healthy, and many more. So I can't give you the dose that you need, right? But what I can tell you is that on your labs, the quote unquote normal range is 30 to 100. Well, that's a huge range, okay? Per Dr. Vasquez, anything below 50, you know, would be insufficient, okay? From a functional perspective or a true health focus. Obviously you saw these studies said insufficiency was less than 20, deficiency was less than 12. Well, both of those are less than 30, so they're both deficiency, right? So from a health standpoint and doing all the jobs we want D to do, 50 is kind of the low end of where you want to be. And then depending on the individual, do we want you at 60 or 70 or 80 or 90? You know, that depends on what's going on. And that could vary in the same individual through time, depending on what's going on.